obtained his PG from Bharatiya Homoeopathic Medical College and Hospital, Bengalore in 2005. At present, he is pursuing his PhD in Harvard University. He is passionate teacher, teaching for the last 20 years. At present, working as associate professor and PG guide in the Department of Medica. He has a well-established practice for the last 22 years in Bangalore. Also presented various papers in different seminars. Dr. Vijaykrishna sir is a staunch follower of Dr. Praful Vijaykar's predictive schools of homeopathy. Today he is going to discuss with us on challenges in acute and realistic responses. Over to you, sir.
Yeah, thank you, Dr. Abhishek.
I will make this up again. Now you can show us.
Yeah, do we need to wait or can we start?
Yes. Yes, sir, you can start. We have 200 plus participants already.
Okay, we can start. Okay, good. Yeah, very good evening to all. And I'll straight away start with the presentation. I'm displaying two images, and what you understand from these two images are that they are soldiers and both of them are going to war. If you see these two images, the one that is on my left hand side is a soldier who is very well equipped. The image that you are seeing on my right hand side is a soldier. He is again going to the war, but he is not all that equipped. The chances of this gentleman surviving will be more when compared to this particular soldier. Now, why I am bringing this example of a soldier who is very well equipped is because as a homeopathic doctor, we need to be equipped with few weapons, with few tools. Now, what are those tools that one should be equipped with is the next question that will come up. The very important tool we should be equipped with will be the organon of medicine. The organon of medicine is like our Bible, it's like our Quran, or it's like our Gita. Without the organon, understanding homeopathy is very, very difficult. So personally, I feel this is one very important weapon we need to have. What are all the other weapons one should have? See, the other very important tool we need to have is repertory. Okay, we will understand this slowly in the next 1 hour or 1 hour 15 minutes, what exactly I mean by all these things. Organon, repertory, not only repertory, Materia Medica is a beautiful tool without which prescribing will become very, very difficult. The last tool I would like to tell you here is the knowledge of allied sciences. So what I want to make very clear is a homeopath will have success when he has a sound knowledge of organon, repertory, Materia Medica, and allied sciences, without which treating our patient effectively will become very, very difficult. So coming to today's topic, what are the challenges that we face in our day in and day out practice? So to be very honest, as a homeopath, I don't think we get very terminally ill cases. We don't get very emergency cases to our clinics. With due respect, I have seen in some homeopathic clinics where they have put up a board, we don't treat emergencies and we don't treat acute cases. What I want to highlight here is, as a homeopath, though we don't get emergencies, but day in and day out, we do get a lot of acute cases. If we are equipped well to treat acute cases, it will be a big bonus for all of us. So my effort in next few minutes is, I will try to look at the challenges that we homeopaths face in our day in and day out practice. The focus today will be mainly about dealing acute cases. Okay, so the topic, as Dr. Abhishek has just read you, is that challenges in acutes day in and day out practice, and what are all the problems we will be facing, and how exactly or what exactly the solution will be is what we are going to discuss. Before I go further, before I go more into the details of the challenges that we face, I would like to thank this great man, Dr. Hanuman, who has introduced a unique science, a divine science. Hats off to this great man. Seeking his blessing, I'll move further. See, though it was Dr. Hanuman who introduced homeopathy, I understood homeopathy better after meeting my teacher, Dr. Proful Vijaykrishna sir. Many of you know this great man, okay? And whatever I am going to share with you today is what I have learned from this great man. So seeking sir's divine blessing, and let many youngsters or many homeopaths get benefited from Vijaykar's teachings. Every case that I am showing you, the results that I am showing you today, the video cases, the reports, the results, I all owe it to him. This is because of this great man that I have got a beautiful practice. Again, many of the participants here should be knowing Dr. Munir sir, my teacher. He has had a great influence in my teaching career. So thanks to sir, and my gratitude have permitted me technical. Okay, I hope things are clear. There are few who say the slides are not changing. Now, what do we do?
Sir,
One
just
second.
share this.
Yeah, one second. Dr. Abhishek, this is not happening. I'm clicking on this. Yeah, many of them have the same problem. Slides are not moving. Okay, one second. I'll just start sharing it. Okay. So,
Okay, sir.
I mean, should I start from the beginning, or shall I continue from where I've stopped?
You should continue, sir.
Yeah. See, like, I mean, what I've tried to show you in the previous slides for participants who could not visualize those slides, what I've tried to do is, I've just tried to thank a few of my teachers, starting with Hanuman sir, then Proful Vijaykarna sir, and of course, my teacher Muni sir. Hope the slides are visible now. We don't have any technical issues. So I was trying to show gratitude to all those patients of mine, as especially those patients who have permitted today to share their cases. They have willingly agreed to share the videos. So a big gratitude to all my patients. And we'll straight away talk about the topic. And I also would like to, yeah, I hope things are clear. Okay, so what we'll do is we'll straight away start with the topic. See, as the topic is related to acutes, when you treat an acute case, there are few things that you need to keep it in your mind. Okay, so what are those few things that you need to keep in your mind? The first very important thing, when you are dealing with an acute case, is you need to form a small totality. You need to form a small acute totality. Now, what are all the components that help us form a small acute totality? To start with, any acute problem will definitely have an ailment. Okay? So, I mean, many of you have been doing this, at least for the newcomers. We'll go step by step so that the concepts are clear, so that you can understand things better. Okay? So again, the technical issues, many of them don't see the slides. That's the constant complaint I've been getting. Now, how do we fix this? See, without slides, without you visualizing the slides, because your videos, it will not be fun. It will not be, the purpose will not be served. Now, can you see this? No, the slides are not changing. My wife is also next to me. She's also watching, and the same problem. Slides are not changing. Should I leave and rejoin, Abhishek? What do we do?
Try to change this, sir. Next button.
Yeah, just hold on for a second. There are some issues. We'll just try. Okay. Am I audible now? Yeah. So what I was trying to tell you here is, see, when you look at the acute totality part, first very important thing, what you need to look at is the ailments from. Okay. See, when you look at the ailments, ailments can be at the level of physical, ailments can be at the level of mental. For example, when you look at few physical ailments, it can be something like trauma, it can be exposure to sun, exposure to cold, overeating, drug overdose, vaccination, they all come under physical causative factors. When you look at the emotional causative factors, I mean, you have under the mind chapter, you have ailments from. There are a lot of rubrics mentioned under that. So ailments from becomes very, very important. So we'll just try to understand slowly. We go step by step. But the first very important thing, you need to probe when you are dealing with an acute disorder or acute disease is ailments from. So focus on ailments from. It can be physical or it can be emotional. See, not only ailments from. Now, what is the effect of the ailments from? Okay, like for example, what exactly is happening to the patient? Is he looking dull, or is he looking? How is his activity getting affected? That is the second very important thing you need to focus about. We'll discuss all this thing. The third thing we also look here is for the thirst part. Is the patient thirsty or is the patient thirstless? Thermals, they become a very important component in understanding acute diseases. Now, the last very important thing here will be hunting for a PQRS. Okay? So these 5 components, they play a very important role in solving an acute disease. Okay? I hope I am very clear with what I'm trying to tell. Please understand these concepts, because next slide onwards we'll be talking about the practical utility. How do we in clinics deal with acute cases? Okay, so these are all the 5 components you need to understand. Now we'll quickly start with a small case. Just observe this case, and preferably I will take up the question answers in the end. Participants, feel free to ask questions, but not now. Make a note of whatever questions you have. We will keep the question and answer session in the end so that the session will go undisturbed. Now focus on the screen. I hope the video is clear. Okay, so I hope you saw a very small clipping of 30 seconds. Okay, very small clipping. Now what is very important for you is, it's a very common thing happening in the medical movies or medical series. There was this professor, a physiology professor, and in the practical hall, when they had to analyze the urine, the urine was kept in the beaker and the urine had to be analyzed. So what he did is, the professor, he makes all the students to stand and he says, see, this is what we are going to examine today. And he puts his finger and he licks the urine. Okay? And he tells all of them to do the same. So first year students, all of them follow the professor. Some 40, 50 students, they come, they put their finger and they lick the urine. And at the end of all of them doing this exercise, the professor tells, you missed something. And what is it that you missed? You did not observe me properly. What did the professor mean there is, the professor dipped a different finger in the beaker and he licked a different finger. So what is very important is observation. Now, what is it that you observe in this particular case? Okay, so I mean, this is a webinar. I don't know how much of interaction we can have, but what is it that you have to observe here, or what is your observation? Yes, very good. Somebody says sleepy eyes. Yes, dullness, drowsiness, beautiful. So what I wanted you to understand here is, now the remedy is very clear. This guy, if you just have a look at him, he's got all those droopiest, beautiful observations made by the participants. He's chilly, he's wearing a sweater, jacket, and the eyes are drooping. He looks very dull, he looks very drowsy. Beautiful. Now, many of you have got the remedy right. I'm not worried about remedy. There's a beautiful saying in the Chinese, there's a beautiful Chinese proverb. Okay, we will not, we'll help you how to fish. Fine, that's a beautiful saying. So remedy is absolutely right. It is very, very obvious. Now, we will see the follow-up. 24 hours after we give a remedy, yeah, 24 hours after a remedy, can you see his eyes? Can you see his face? Can you see the dullness disappearing? So you can just listen to the video. You can see the video. So the mother says the fever was 102 degrees. He was not given paracetamol. He was given a simple homeopathic remedy, and that remedy, which many of you have got it absolutely right, and the remedy is gelsemium. So gelsemium 1 ml, a single dose was given, and you see the results. We'll go ahead, we'll see a few more cases. We have another case here. This is the case of a lady, who had come to my clinic, and she had menorrhagia. She had consulted a lot of gynecologists. They used to give her hormonal pills. She takes the pills, it stops, and again the flow continues. So we have taken this case, and I'll not get into the details of the case because we have a lot of things to discuss here. Now, what I was trying to tell you in this case was, so there was this lady who came with severe bleeding for almost 4 or 5 months, and we are trying to understand what happened. Why is this particular lady bleeding so much? So in the case, she narrates an incident where, she was angry with herself. She made some mistake, and the reaction of this particular patient was she was very angry about herself. And in the case taking, what she used to do is she used to narrate that incident, and she used to weep so much. And at the end of weeping, she would take a deep sigh. So what I would observe here is there was a pattern. She would weep, and after weeping, she would sigh. She would narrate her complaints, she would weep, and she would sigh. So this is an observation that I made. And what was the rubrics? 2 rubrics that we took was anger. Yeah, the remedy is absolutely right. I'm happy. The doctors are giving the remedies very fast. Beautiful. I'm happy. Now, what 2 rubrics that we took here was anger himself with. That was 1 rubric I took. And second thing, sighing after continuous weeping. These were the 2 remedies, 2 rubrics taken, and she was prescribed ignitia, and the bleeding stopped, and she started getting menses regularly the following months. So observation is very, very important. I'll again share a few more cases here so that you understand the concept of observation becomes very, very important. Okay. Now we had another case. Please solve this case. He is a boy, aged around 17 years. He is doing a second year PUC. And what was that we observed is when we were taking the case, homeopathic case taking, when we used to ask him questions, and those questions where he had to concentrate too much, he would do something like this, he would keep doing this. Now, how do you interpret this? Can somebody quickly, how do you interpret this particular rubric? And this was my observation in the clinic, while answering something difficult, like, you would always do this and then you would answer. Somebody who could quickly tell, or you could just type. No, video I'll show you. There's no video, it's very plain. See, yeah, somebody says rubbing his head while answering. That's a nice thought. Now, this person is not rubbing his forehead every time when he's answering. Mind you, that is very, very important. It is not that cobweb sensation. Yeah, good thinking. Impulsive, there's nothing impulsive here. Somebody says restless. See, restlessness is something different. Now, what is very important for you here is, I am lucky I had a very intelligent assistant with me. I don't know if Dr. Varshini is here with me or not. I am not very sure. But what I want to try to tell you is, Dr. Varshini came up with a rubric, and I'll just share that rubric here. See the beauty. Concentration difficult, rubbing the forehead when trying to concentrate. See, when he's trying to concentrate, no, that is when he starts rubbing his forehead. You're getting my point? This is something that is happening in front of us. You see so many patients, and not all patients do this. And see the remedy. The remedy is hellivorous. And the quick question that we asked was, what you don't like in eating? And my assistants are there. I have the video, but I don't have the permission of the patient. So I'm not sharing the video here due to ethical reasons. Now, the immediate thing that came up here was, he said, sir, his mother who was sitting next to him, she says he doesn't like vegetables. And you all know from your Materia Medica, hellivorous is one remedy which has a strong aversion to vegetables. He was very poor in studies. He was given hellivorous. We followed up this case for next 6 months. Concentration improved, memory improved. He fared well in his exams. So these are few things that you have to remember. I will again talk one more small case where observation becomes very, very important. Now, this was a 13-year-old girl who had come to my clinic. A few of the assistant doctors who are attending the webinar, they have seen this case. And this girl, she was brought with the fever, 102 or 103 was the fever. And what was that one thing that we observed in this girl was, she used to close her eyes and she used to talk. It's a very beautiful video, but I can't show you because I don't have the permission. But anyway, what I was trying to tell you here is, this particular patient would close her eyes while speaking. Now, quickly, can we have some interaction here? How do you interpret this particular rubric? How do you interpret? You're all there? Beautiful. Shweta, she is my assistant. She was there. And I'm happy. Shweta remembers this particular rubric. See, this girl had photophobia. Okay. And see, don't look at other things like, what is it? Talking. While talking, she is closing eyes. It is not that. Typically, in fever, when she was in fever, she would close her eyes. Because when she make it a point to ask, why? Don't jump into conclusions. Patient is the person who is suffering. So don't go into hypothesis. You please ask Miss X, Y, and Z, why are you closing your eyes? And what was the answer that came up? Sir, I'm not able to bear the light. Mother confirms during fever, she can't look at light. See the rubric that you have in your repertory. See the rubric. Photophobia, under the chapter I, you have photophobia. In that, you have a sub-rubric, fever during. Is it not a beautiful thing? The entire search will come down to 6 remedies. I hope you're getting this. Fine. And based on the other totality, we prescribed our ferrum fast. And probably the assistant who have seen this case, after 5-10 minutes, she was made to sit in the waiting room. We made her inhale ferrum fast 1M, and she beautifully recovers. These are all magical cures that homeopathy can give. Okay, so I hope you are clear with the first component I am trying to discuss. And Dr. Hahnemann himself, he has mentioned in his aphorism the Bible, the Gita, the Quran that we were talking of. Aphorism number 90, and under footnote number 85, Dr. Hahnemann beautifully tells what we need to observe. Okay, so please refer back. I'll not go into the organon part much. I'll keep giving you the aphorisms. Okay, so now under observation, what we understood is observation makes things very, very easy for us. Now, what are the importance of observation? See, observation are important in all cases, okay? But the skill of observing becomes more important when you're dealing with pediatric cases. Okay, you have pediatric cases, fine. Their observations are nothing but the objective symptoms, fine. So the scope will be more in those cases, the pediatric cases or any case. Now, what are all the barriers? What are all the barriers when we talk of observation? See, the knowledge of the physician is a limitation when it comes to observation. I'll just clarify this particular thing, what I'm trying to explain here. Say, for example, you have a SINA child in your clinic. The child is cranky, the child goes from father to mother, the child keeps rubbing her nose against the dad or against the shoulder of the person, somebody. See, these are all the things that are happening in front of you. But if you don't have the knowledge that, you have to observe, you have to take these things into consideration, then it will become a waste. Eyes don't see what the mind doesn't understand or what the mind doesn't know. Okay, so this is with observation. Next very important thing is, I'll just give you a small demo. I'll just share a small case how we make a small totality. Now this is very important, how a totality has to be made. Fine. See, now this is a nice case, a very fresh case. One of my old patient, 21st July 2020, he gives me a call over the phone and he says, sir, one of my relative is sick because of COVID. She is an aged lady. She can't come to your clinic. Can we please have a consultation over the phone? I said, fair. Okay, what are her complaints? Then I spoke to the lady and the lady told, sir, I'm so-and-so, I'm 65 plus and I'm suffering with acidity for last 2 days. I'm feeling very anxious, a lot of palpitation, anxiety. See, when they say when they're feeling anxious, definitely ask for modalities, and also you need to ask where exactly they're feeling anxious. Okay, remedies, anxiety in chest, anxiety in abdomen, anxiety in genitalia, different areas. So the question I asked is, where exactly you feel anxious? So anxiety felt more in chest. And last few days, probably a week, she's becoming very anxious for small things. Okay. Now, I told you the first component of acute case taking is there will be a definite causative factor. Now, I asked her the same thing. Since when you are fine and since when all these complaints started? See, meanwhile, she also has gone to an allopathic doctor for anxiety and all those things. They have given her some tablets. She has taken the tablets and then she starts with acidity. She also tells that, there's a pet which expired 3 days back. And she was very much attached to the pet and she feels very sad that the pet has died. Now, this is the small case that we have. If you can quickly give me your inputs, I'll be happy. Otherwise, we'll move ahead. A lot of things to discuss. Okay. So now what I did here is, can somebody want to interact here? Tell me what exactly you would like to take. Yes, very good. One of the doctors says ailments from grief, ailments from shock. Okay. And, any other inputs from your side. See, more than shock, grief, I took into consideration ailments from death of child loved ones. Okay. And this was the entry point. This was the causative factor. She was fine till the pet expired. After the pet expired, she started with symptoms. And she consulted an allopathic doctor. They gave her antacids, they gave her some medicines. In spite of all that, she develops acidity. So my second rubric is, the remedy that I'm prescribing should be sensitive to allopathic medicines. That's the second rubric. And she's very anxious. She told us small things. last 3-4 days I'm becoming very anxious. And where is the anxiety felt? The anxiety is felt in chest. So a small totality was made, and the outcome of the totality is ignitia, nux vomica, sulfur. Okay. Now, I told you, knowledge of materia medica is very, very important. Sulfur, I ruled out based on a very simple thing about her thermals. She was chilly. So sulfur was ruled out. Now we're left with ignitia and nux vomica. Now, if it was nux vomica or if it was ignitia, now how do you differentiate nux vomica and ignitia? Both are very, very similar. Both are very, very similar. But nux for me in an acute should have sensitiveness to the what is it, like, senses. Like, for example, they'll be very, very sensitive to noise. Somebody talking, it irritates them. Unfortunately, in this case, that was missing. Now, the remedy that I am left out is with ignitia. Friends, I will give you a small clue how you rule out ignitia in such acute cases. When you have acute complaints, when you have grief, one very important thing you need to ask in a patient is ask if she is feeling some kind of a constriction or some kind of an uneasiness in the throat. So this patient quickly says, yes, sir, I feel something has been stuck. Now that is the important point. And we prescribed her ignitia 1M. Okay, 24 hours, 36 hours, she was very fine with the anxiety. She was not all that anxious, and she relaxed and she felt better. So when you take an acute case, make sure you form an acute totality and you start prescribing. Okay, so I hope that case was clear. We'll move ahead. A very simple case again, a very fresh case which was brought today 2nd. 5-6 days back we had this case. See, it's an infant. Father was carrying this child, 8 months old child, and father told, sir, for past 3 days, the child is crying. The child is very, very irritable. Though I asked what happened last 3 days back, any change with mother's diet, any change with mother's emotions, because mother was breastfeeding the child. I did not get anything like that. But what was that very important thing the intelligent father told when I questioned, when does the child cry more? The father told, sir, child is comfortable whole night. The problem we have is only in the day the child is restless, is crying and is passing a lot of gas. Friends, it's a very simple case. Now what I'm trying to tell you next is, we will try to talk of, or we'll try to take up a very important aspect, and that is eliciting PQRS. Many of your friends have got the remedy right. The remedy I gave was Lycopodium 1M. You all know, Lycochild is the child who is having colicky pains the whole day, and if it is whole night, the remedy is Jalapa. You know that, we have read from our Materia Medica. But what led us to Lycopodium was the child having colic in the day and being comfortable at night. So it is a PQRS symptom. See, if you look at the next slide, what I'm trying to share with you is our thought process should be within Hahnemann's principles. Okay, that is what even my sir is very, very particular about. He will not go away from Hahnemann's thought process. So what I want to try to tell you here is individualization. Even if it is an acute case, make sure you individualize the case. Now the question is, how do we individualize the case? See, individualization comes, or you can individualize a case from hunting for PQRS. So always look for PQRS, fine? Fine. So Hahnemann, in his organon, he has mentioned in 153, 178, 209. I'll not go into the details of the aphorism, but I want you to know that this webinar is based on what Dr. Hanuman is speaking. Right? We'll quickly talk of a case. This is a follow-up case. Please. So audio is not audible. Okay. See now, this case, I mean, there are some technical issues with the audio. That's what a few of the speakers have told. But for your convenience, we have also tried to type. Dikshit has taken pains to give the subtitles because she's talking in our language, and this is a webinar on a different platform. See, what I wanted you to understand here is this lady had come to me with fever, with bad chills, severe body pains. Okay. Now, what was the PQRS that we got in this particular lady was she used to moan. I hope you all understand moaning. For the beginners, moaning will be more of a piteous cry. When you are in pain, when you are in grief, when you are in sorrow, you start making those sounds. If you want me to give you a demo, ayo, amma, those are all the piteous sounds the patient makes. So this particular lady used to moan only during the chill stage of the fever. I hope you are getting this point. When somebody comes to your clinic tomorrow and there is this observation that the patient is moaning, please don't take the rubric moaning in general. Please try to individualize. Now, this is something I want to stress here. So when you see sub-rubrics, there is a sub-rubric, and this is the sub-rubric that we have taken, moaning chill during. See, the search will be limited to 6 remedies. Okay, and based on the symptoms that she told, that severe body pain, as if it is been wounded, okay, severe pains, and she was restless, and the remedy that was given to her was arnica. And after arnica, you have the follow-up, which I've just shared with you. So PQRS should be given a lot of importance. Okay, now how will you get to know if the symptoms given by the patient, if they are common or uncommon? Now, this is where your weapon, your tool of understanding allied subject better helps you. Okay, so knowledge of allied subjects will help us to differentiate common and uncommon. So never neglect allied subject. Many of us have this feeling, no, why surgery, why medicine, why pediatrics? You should know everything. Okay, so PQRS is what we were just trying to understand. I'll quickly talk of another case and then we'll move further. See, many of the practitioners will come across such cases, and this is a case, we were about to close our clinic, and then we had this gentleman who presented to us with severe pain in the back, unbearable pain, and pain was in the left lumbar region, and pain moved down. Again, talking of the knowledge of allied subjects, you know that this pain that we are talking about, see, suddenly somebody jumped into bryonia. Now, please don't jump into remedies. I appreciate, but don't do this mistake in your clinic. Understand the case. Just because we said patient had severe pain is not able to move, we jump into bryonia. Right? Now, see, this was a typical case of renal colic. Okay, and he had renal stones 2 years back, and he had undergone lithotripsy. Slightest movement is bringing on pain, and is in a bad pain. Okay. Now many of us will come across such cases in our clinic. Now here we will not have so much of time to take the case in detail because the patient is in pain. Okay. So what I did was I prescribed him a remedy. Okay. And you know what happened in the morning? Morning, he sends me a pic on the WhatsApp and he shows, a picture where he has passed a 6 into 4 renal calculi. Right? So the remedy that we gave from the small totality we made was Berberis vulgaris. You all know, you have studied this in your second year. Typical renal pains, left side, slightest movements like jarring aggravates the pain. The remedy is Berberis. Now the story will not end here. This gentleman has a tendency for stones. So after this, next we ask him to come back to us, and then we take the case in detail and we prescribe a constitutional remedy. Okay, these are all few challenges that we face day in and day out. One more challenging case that I had in my clinic. This is my clinic, and I had in my clinic was, you just listen to his follow-up here. From his face, you can make out he's not very, it doesn't look very healthy. Okay. So what had happened was, this man had collapsed in the clinic. We have a waiting area there. In the clinic, he had collapsed. And the people who were waiting, the patients who were waiting, they rushed inside and said, "Sir, there is an emergency. One of your patients has collapsed." The wife ran in. Everybody ran in. There was a big scene outside. So, assistants and me, we entered and we saw this man has collapsed. Right? Okay, now how do we go ahead? Don't tell me the remedies. The remedies are secondary, it will come. But how do we go ahead with this case? Should we call an ambulance? Should we refer the patient? Okay. There are so many other patients looking at your managing skills. How are you managing this emergency situation? Your esteem is at stake. There are 3-4 assistants standing behind you. They want to know how exactly you are approaching this case. It's a challenge. Okay. Now, I've shown you what had happened or what 10 minutes after the remedy that we are given. The patient will tell you that. But what happened before 10 minutes is he collapsed. Right? Now, many of you are coming to the right point. We need to examine, we need to observe, look for his pulse, look for his BP. Okay. Now, why did this lady or why did this patient come to me basically for? He had come to me to consult for fever. Okay. Right? So there is one rubric. Before I tell you the rubric, you can just look at him. And he's still not completely normal. But from the collapse, he sitting independently and talking after a dose of your remedy is a magic. The patients who saw this case outside will never leave homeopathy. And the the junior doctors who were with me that day, their belief in homeopathy would have doubled. Their confidence in homeopathy would have doubled. See, now he collapsed, and what I was trying to tell you is, when you are treating an acute case, your results should be very, very fast. Okay. Now, what we did was, we took 2 very important rubrics. One was he collapsed with fever. Okay. And the second important thing, what we saw, the pulse, the BP, and all those things, his entire body was covered with cold sweat. And that's why I also got his ECG checked after he came out of the collapse state. Once he regained his consciousness, we asked him to get his ECG checked. It was almost like, a person has MI. Many of you would have seen MI cases. That was the kind of a state he was into. 3 remedies which has that kind of coldness. Out of the 9 remedies we have here, one is camphora, the other one is carboveg, and the other one is veratanol. These are all the 3 remedies which has coldness. Okay. And from what we have learned so many years from our Materia Medica, the coldness and that collapse, the only remedy that stuck in that emergency situation was carboveg. Okay. And there are, the juniors, doctors who are having clinics now, they have attended, they have seen this case. Carbo-veg, now how do you give carbo-veg? That's also very important. He was in a collapse state. So what we did was, aphorism number 284, Dr. Hanuman says, you have to give medicines through olfaction. I've seen this with my sir, Vijaykrishna sir. We are fortunate to see cases, where sir gives olfaction and the patient quickly improves. The same method I adopted here. This gentleman was given olfaction. He was made to inhale camphora. He was made to inhale carbo-veg tandem, and after 5-10 minutes, to the beauty of homeopathy. And this gentleman, we could not record. I don't know. We were all in a very panicky state. So many people around. We were worried what to do, what next. Why did he collapse? So carbo-veg was given, and mind you, in acutes, we will not have time. If it is a chronic case, you'll have a lot of time. You can take case, the patient can come back to you after 15 days. You can just ask them to get back. This is an acute state. It's in a state of collapse. So how do you do this? Like, we put a few drops of camphora on cotton and we took close to his nostril, and I don't know why camphora is coming, but carbo-veg is the remedy we give, and this is how we do. We put few drops on cotton and take it close to the patient, or you can also rub. But I personally feel, in this case at least, we gave olfaction and he quickly comes out. And this is what he's trying to share. What happened? How did he come out? All those things. Okay. So we'll go ahead. Results should be fast. That's very, very important. Now, another very important question that keeps coming to many of us is, when do we repeat? In acutes, as a predictive practitioner, very rarely we get a chance to repeat the simillimum. Okay, but there are instances where we do repeat. I'll just share a small case. Everything here we will try to substantiate, justify with cases, so that it gets, it will have a deep impact and you will not miss such things in your practice tomorrow. So we had a PG student from our college. He has given consent to share his case. See, it was a very important case for us because he had his exams and he was down with fever, and there was an uncertainty whether he can take up his exams. So many of us were worried for him. And what had happened was, he had fever. I prescribed him gelsemium, and another doctor prescribed something else, and unfortunately, he was not improving. The fever used to go up, go up, go up. And one of his colleague, she had prescribed China. Okay, and after she prescribed China, there was an improvement, and then there was no further progress in the improvement. Again, they got back to me and said, tomorrow morning is the exam. What do we do? What exactly has to be done? Again, we took the case, and to our utter surprise, the picture was still China. Okay, the picture was still China. Here, what we did was, we gave him China 10 single dose. Okay, and by evening, his weakness came down, his fever came down, and the beauty was, next morning he could write his exams. Now, all these cases that I'm discussing, they're all very fresh cases, last 15 days, 20 days. And only few cases are old cases, which I have brought in for your understanding. Now, why I'm trying to tell you here, what I'm trying to tell you here is, there is this COVID situation happening. In the COVID background, any fever, any cold, any cough is a very scary thing, right? So this PG doctor of ours, he beautifully improved with China 10, weakness gone, fever gone, and next day morning, we were happy that he could write his exams, attend his exams. So my topic for now is, when do we repeat a simillimum in an acute case? Okay. Now, I have few criteria. You can take a pick or you can keep this in your mind. When the picture of the same remedy remains, I hope I am clear with what I am trying to convey here. When the picture of the same remedy remains, meaning China picture was still there. China picture was still there. So we gave a higher dose of China. Okay. When there has been a relief and the relief is not complete. If you go back to this case of ours, China relieved, China 200 relieved, but the relief was not complete. Okay. Now why China 10? Again, we go back to our Bible. Now this is what Dr. Hahnemann says. There is no fun in repeating remedy in the same potency. He says, increase the potency and repeat. So FRSM 247, please go back and have a look. So these are the criteria where in acutes, I personally repeat in my clinic. We'll again take up a very interesting case. Have a look at the thing. Now, before I start this case, this is one of my colleagues' daughter. I'm thankful to him. He is also here today attending the webinar. I'm thankful to him for permitting me to use the videos. I have not masked the face also because he was generous enough. Sir, let the participant learn. It's a learning activity. I thank him. I will not take his name, but I personally thank him for permitting me to share this case in today's webinar. A very interesting case. Please observe this case. Observation, very, very important. Have a look at the case. Now, this is in the sleeping thing, the small video, and this video, they have made her sit and they have taken a small video so that I understand what exactly is the case. Fine. So we'll look into the case. I got a call on 28th July, all fresh cases, 1:30 p.m. I get a call from a very good colleague of mine, and he says, sir, my child is down with fever. I need some medicines. Okay, this is the simple statement made by my colleague. Now, you know, from what we have learned a little while ago, we'll have a lot of questions. Now, what are those questions? How did it start? When did this start? Etc. etc. Now, the questions that I asked here is, please narrate me from when she had fever. Okay. Now, you see the narration that my colleague used over the phone. 26th evening, she did cycling. 27th morning, she starts with fever. 10 a.m., they give her few doses of arnica 200. No change. Arnica 1 m is repeated. No change. Fever continues. Child is drowsy, dull. Gelsemium is given. No change. And few doses of staphylococcus is given. Now, this is what I get in the background. And fever is very high, 102, 103. Even paracetamol is not relieving the fever. It was a very panicky situation. Paracetamol not helping, and the list of homeopathic remedies they have given is not helping. So what next? Now we'll come to the present. Now I asked him, what is the present state of the child? Sir, at present, the child is very tired. She's not responding. You saw the videos. She's not able to sit. She's not able to walk. She's just lying down, not asking anything. Temperature is not coming to normal in spite of giving paracetamol. Now, this is what the father narrates over the phone. Now, what do you do? So what we did was, a remedy was given, okay? And after a remedy, this is what happens. I hope you remember the video that you had seen few minutes back, and this is the video. I hope you appreciate the changes. Okay. Now, the story does not end here. The child has become active a little better, but in the follow-up, the father says, sir, there is no taste. The child doesn't feel like eating. No energy. child feels like lying down. Fever is slowly increasing, sir. Now we'll get back. So what I did here was, here looking at the state, the child was chilly, the child was dull, the child was not interested in anything. Lot of wrong homeopathic medicines were prescribed, and you know the remedy. The remedy we gave her was Sepia 1M. Okay, Sepia 1M. And after Sepia, she improves. Again, she goes back into the fever state. We repeat one more dose of Sepia, absolutely no change. And after a repetition of Sepia, this is what happens. Now tell me what to do. So Sepia gives relief, but again, she comes back to her normal state. She's down with fever. Now, these are the common situations we all face in our clinic. Okay, so now what do we do? What do we do? Now, what do we do is the question. Okay, so one of our doctor friends says, sir, think of complementary. Beautiful. Okay, Sepia removed the ill effects of other remedies. Good. One more, participant says, good, agreed, beautiful. See, I'm happy with the inputs. You are thinking in the right direction. Okay. So now, what you have to understand is here we had to change. Now I'll tell you why I had to change. Now, when will you change? This again a small question, so that we have an interaction and it will not become a one-sided affair. One more doctor says, you can also think of Sepia in high dose. That's a good thought. See, Sepia given in 1M and the state comes back. I'll tell you, it's a nice thought, but why we did not repeat Sepia? I spoke to my colleague, I told him, give her Sepia 10M. But unfortunately, he did not have Sepia 10M. These are all some practical problems we face. We do not have Sepia 10M. Now, what do we do? When to change? There are a lot of inputs. One of our madam says, can we think of an intercurrent? Good thought. Okay. Now, when to change? See, I have thought of few situations when you have to change. When patient doesn't improve, when the case is in standstill, you may have to change. Okay. No change in general well-being. These are all very, very important. No change in general well-being. Okay. And a new picture comes up. A new picture comes up. And when the improvement is not happening according to Herring's law, very, very important. Okay. And the last thing here is when the intensity of the symptoms increases. These are few things you can add. There are very, senior homeopaths in the webinar today. There are teachers. You can come up with few more points, but these are few points that I could think of. Okay. Now, what happened here when my colleague again called, sir, you gave Sepia, she's fine, and now she's again back with fever. Now, what had happened here in this case was the girl who was chilly now starts feeling hot. She's dull, she's thirstless, she's feeling hot. And over the phone, I hear the father talking to the girl and the girl responding to the father. You know, the girl responds in a very piteous way to the questions the father asks. And, you see the follow-up here. This is after 6 to 8 hours after we give another remedy. I had to change the remedy. Yes. Now this is what we all doctors, we homeopaths, we wait for this smile on the patient. Right? So this smile is what we were all waiting for. Now what we did here is, she improved with Sepia. Agreed? She improved with Sepia. So the new remedy that I wanted was a remedy in relationship to Sepia. Okay. So she was hot. I have removed all the chilly remedies. I don't need the chilly remedies. She was hot and I had to differentiate between natramio, sabardilla, sulfur, CV, conium, lycopodium, and pulsatilla. Her palms were not hot. She was not introverted. She was not reserved. There was no vomiting. She was thirstless. Natramure is typically thirsty. Carbamide, that slowness was not there. Conium, I'm sorry, I don't know the acute indications of conium. Lycopodium for me is a diligent remedy, meaning they will like seeing into books, they will like doing something, they want hot things. But for me here, that pity speech that she was answering to the dad, not interested in anything, and many of you got it absolutely right. The single dose remedy that we prescribed was pulsatilla, and it's been almost 4 days since we have given pulsatilla. She's doing fine. She's eating well. Her generals have improved. She's back to normal. A big relief to my colleague, a big relief to me that we could bring that smile back on this young baby. Okay, and thanks to my colleague for again permitting me to share this case. Now, this was one case where I wanted to show you or tell you when exactly we change the remedy. Now, another very important challenge here will be interpreting the symptoms from the patient's point of view and applying it into the knowledge of repertory. This is a very important component. So we'll straight away talk of a case. Please observe, then we will have a small discussion and then we'll go ahead. Yeah, I hope you are clear with the video. Yes, there are some inputs coming up. Yes, this patient was rolling over the floor. Okay, she had bad abdominal pain. She was tossing in agony. Yes, what else you observe here? See, this was a very important case for me, and every case is important for a homeopath. Now, this case, why is it important is, with due respect to this patient, she was the one, who felt this case has to be shared today because she's a homeopath, fine. And whenever you are treating the students belonging to the homeopathic college, you'll have extra responsibility. Because if they're not convinced that the homeopathic remedies are not working, they will lose faith in homeopathy. So she is a homeopathic scholar, and she had a lot of pains. We gave 2 remedies, meaning 2 remedies were given. The first remedy that I gave was looking into the restlessness. I prescribed arsenicamol. She was tossing on the floor, etc., etc. Arsenicamol, R-sal was prescribed. Nothing happened. We also tried to understand what happened. Why is she suffering so much? Why did she go into an acute state? Was there some emotional disturbance? No, nothing. She was apparently fine when she came to college, and suddenly she starts. So we are not getting a causative factor here. And in that state, I can't go and ask, though the PG students did make an effort to ask what caused, it was not very clear. So we had to only observe, and we had to interpret, and we had to convert into repertorial language. So what I did was, I took all these things, 3 very important things. Mourning, you saw that, ayo, amma. So she was mourning with pain. And there was a lot of anguish. Anguish for us is syphilitic anxiety, a lot of mental agony. Fine? She was suffering a lot of pain. Anguish, again, I did not take the broader rubric, I went for the sub-rubric. What is causing anguish in her? The pain in the abdomen is causing anguish in her. So anguish, pain in abdomen from, moaning pains from, and many of you have told restlessness pains from. These things were considered. We got chamomilla, we got coffea, we got colocin. 2 remedies were given, arsenicum, glycopodium, no change. She was suffering so much. Then the friends who were concerned about her, they said, sir, we'll take her to allopath because we are not finding any improvement. You have been giving medicines and our friend is suffering. We don't see any improvement. Right? So the stage had come where they wanted to consult an allopathic doctor. Now, is it chamomilla, is it coffea, or is it colocin? See, if it was colocin, somebody rightly said, colocin should have had a suppressed anger. Don't forget colocin when a patient comes to a clinic with abdominal complaints and it is after suppressed anger. Okay, so there was no suppressed anger. And one of my madam says chamomilla. Now, why we did not think of chamomilla? Now, chamomilla, when they have the pain, the way they react in pain, they become very irritable. That irritability was missing in her. And what I also thought was, somewhere I felt there was an element of hysteria because she comes normally to the college and then there was no exciting factor and then she suddenly starts with all these things. So colocin gone, chamomilla gone, and the remedy I prescribed her was coffea. Coffea 1 1 dose. And she was more than willing to give the follow-up video. This we recorded probably yesterday. And this is the video that she recalls what happened that day. Okay, see, there are many of them who are telling they are not able to hear, there's no audio. But what I want you to understand here is, she shares her experience, what happened after a right homeopathic medicine. Within 5 minutes, our pains are better, fine? So that is the beauty, that is the power of a right homeopathic medicine. It works very fast. And people who say homeopathy is slow are those people who have not understood homeopathy. Homeopathy takes time. It's in chronic cases. Hahnemann himself has told in some aphorism. So interpreting is very, very important. I'll again share a small case here. Now I have tried to show you a calendar. You should be worrying. What has a calendar got to do in today's presentation? Seriously, we all have calendars in our clinic, on our wall, on our table. But after meeting Vijaykrishna sir, I understood the importance of a calendar. Okay, I'll just justify my learning with sir, a simple learning with sir, and how beautifully it helped me, or how beautifully things are helping me. Yes, for moon phase we keep calendar, agreed, very good. Now, what I would like to share here is, we had the wife who had come to consult for her husband. Now, wife told that the husband is having sleeplessness. Last 3 nights he is not been able to sleep. So again, simple thing. You please go back. Why I'm giving you the example of calendar is, today is what? Today is 8th. assuming today says, now 3 days back, so you please go back and ask, 3 days back, 5th, what happened? Before the problem started, what happened? Something should have happened. You will have to be very, very firm in asking. So something should have happened. Then she gave me some explanation, and she told there was some small rift with her daughter. Husband and daughter fought for something. Yeah. So husband and daughter fought for something, and the daughter has come for medicines for her husband. This is not possible. I told, phone your husband. I would like to talk to him. So she connected to him and I spoke to him. What exactly happened? Sir, 3 days back, no, I mean, you have to be very stern. You are not awesome. Something happened. What happened? Why your sleep is getting disturbed? You used to sleep all these days so normally. Last 3 days, why your sleep is getting disturbed? So what had happened was that night, there was an argument, and the daughter, in front of his parents, in front of his wife, in front of his son, she blasted the father. And how did you feel? What did you feel? Sir, I felt ashamed. I felt embarrassed in front of my parents, in front of my wife, my own daughter, who is 13 years, and she's scolding me. I felt very bad. I felt ashamed. Right? Point. Okay. So it also makes sure that this is justifying the fact that ailment should be there. There will be no smoke without fire. So what we did was, now how do you convert this into a rubric? How do you convert this into a rubric? One of my friends says indignation, embarrassment, yes, anything else you can think of, humiliation. My colleague also says, Dr. Chandana says, Staphysagra is the remedy. Okay, good, beautiful. I'm happy, you're all thinking in the right line. Okay. See, now what rubric I took here was okay, admonition, embarrassment. See, more than embarrassment. Embarrassment was a part. With embarrassment, he also felt insulted. A combination of embarrassment and insult is mortification. You getting my point? Combination of insult and embarrassment is mortification. So now what do? We go under mind, we look for ailments from mortification. You have some 60-65 remedies. Your search will be very large. Now what is the target organ? Did it affect his stomach? Did it affect his intestines? What is getting disturbed? His sleep is getting disturbed. So one of your friends has rightly given the rubric, very good. The rubric that we took was sleeplessness, mortification after. Sleeplessness, mortification after. Now see, that's what I'm trying to tell you. This method helps you narrow down the search. Now you have to differentiate 4 remedies. Calcarea, colocynth, ignitia, staphysagra. Now, from my experience, what I told my patients was pack ignitia. Ignitia was almost getting packed from my assistants. Then wife said something. Sir, that day when all this happened, wife slept with the daughter. Wife did not sleep with the husband. So he felt more bad. Now, she was trying to tell me, sir, whenever such situations happen, when I don't sleep with him, he feels very bad. Now again, a question will come up. Why he wants the wife? Is it for the physical relationship? No, why he wants you? What is it that is causing sadness in him? Or what is it that is affecting him when you don't sleep with him? She says, sir, nothing like physical and all. He always wants me. Right? He always wants me for support is the word that lady used. I have the recording, but could not meet the patient to take the permission. Okay. And now staphysagra goes, and many of you got the remedy right. The remedy is calcarea carb. You're getting my point. Absolutely right. Many of you got it right. The remedy which needs support, the 4 remedies. See, you not sleeping, you sleeping with my daughter, and if he's insulted, probably ignitia will come. Probably staphysagra will come. But here it is not that insult. Here it is more of what more of support, right? So calcarea cough was given. After 2 days, wife calls telling husband has got very sound sleep. These are all very encouraging things to share. Continuing, I hope you had clarity with the case. Continuing with a few more things here. See, many times acutes can open a new avenue, meaning we have cases, for example, acid first was given for acutes, and the diabetes, which was not curing for so many months with other homeopathic remedies, after acid first given as an acute remedy, takes care of DM. My wife, who's also a homeopath, yeah, there is one question one of your friend is asking, what calendar has got to do with this case? See, calendar has got nothing to do. You don't take it so seriously, but what I was trying to tell you is, this will help you in analyzing when the thing started, which day. They have come to you on 8th and the complaints have started. You can specifically point out and you can ask them, what happened a few days back? Okay, don't take the other meaning of calendar. This will only help us in arriving which day. Sir, Friday, today is Friday. I have got problems since Wednesday. So you can go back and ask what happened on Wednesday. That's the only importance, no other importance. Okay. So the potency calcarea was given in 1M. Okay. Now I'll get back to the other part. In the acutes, when you prescribe based on acute totality, sometimes the chronic cases get solved. So it's a kind of a compliment for you, complementary thing that you're getting here. And investigations in acutes, they also play a very, very important role. Okay, so investigations, for example, like X-ray finding, okay, or an abdominal scan, which will tell you where the stone is, or some acutes which will have a deeper pathology. For example, acute myeloid leukemia might present to you with fever, but if you get the CBC done, the WBC counts may be very high. In typhoid, there might be leukopenia. So these are few clues that you'll get from getting investigations done. Okay. So I'll again continue with few more cases here. Now, what I want to try to tell you here is, in aphorism number 150, Hahnemann talks of indisposition. Many times we homeopaths prescribe for indisposition, and Hahnemann says it is not required. I'll just say a small case, when to prescribe, when not to prescribe in cases of indisposition. A child was brought to my clinic with history of loose stools. Okay, now this child ate something out and child has got loose stools. And I examined, there was no signs of dehydration. So PL was given every hour and one medicine was packed as SOS. Next day morning, the mother calls back and says, sir, loose stools has increased and he has started vomiting. See, till here in the first slide, it looks more like indisposition. Now, this indisposition is slowly progressing into an acute GE. He is becoming weak, there is dehydration, mother goes into a panic mode and she says, sir, should I consult a pediatrician? I told, no, wait. I have given you an emergency packet, you give that packet, and that packet you all know is a very simple medicine. Arsenica malt was given, food poisoning, that weakness and all those things. And by evening, child settles down. First thing that should improve is vomiting. Loose stools will continue, don't worry about the loose stools. Body is trying to eliminate toxins, but vomiting should be taken care. Dehydration should improve, weakness should improve. So, as a very good homeopath, you should know in a case of indisposition when to prescribe and not to prescribe. 150 and in 151, Hahnemann says where you should prescribe in case of indisposition. Again, a very interesting case. You please listen to this case and I will discuss. Okay. See, now again, many of you are telling, there's a problem with audio. Okay. So I'll just narrate this case. See, this case had come to me a day prior. And on the emergency basis, this case was seen in the next chamber. We don't have a video there. But what we had seen there was this child had 102 plus fever and he was stuck to the mother and he was very cranky. He was stuck to the mother and he was crying continuously and he was not able to swallow anything. Okay. So what rubrics can you think of here quickly? What rubrics can you think here? That child was not able to, swallow one thing and child was stuck to the mother. He was not coming away from the mother and we had a lot of difficulties examining him. Okay. See now, when you see such children, yes, when you see such children, the first thing that should come to your mind is clinging. Somebody has said magnetism. See, magnetism for you here is just, for example, I have a case, yesterday we prescribed ignitia to this particular case. He wants his wife next to him and he wants his wife to rub over his back. So this rubbing, this pressing, you can take it as magnetism. Here, the child does not want to be rubbed. The child does not want to be pressed. The child is not wants to be carried. Carried and clinging, they are two different things. The child here is clinging. Okay. So what I observed is the child is clinging to the mother. Now, clinging to the mother, you have some 8 to 9 remedies. Now, I'm trying to tell you here the importance of examination. Many homeopaths, we don't bother to examine. So what I did was we examined here and what we saw was the hard palate had lot of ulcers. And that's what the mother was trying to tell us in the video. Yesterday, not even a drop of milk, drop of water he was able to take. So evening you prescribe a remedy and next day, evening the mother comes back, child is happy, mother is happy. You can see the zeal in the mother's voice. Fine. He's eating, he's drinking, there's no fever. 2 rubrics were taken. Clinging, person, furniture too, which many of you have got. And this rubric I took after examination. Why the child is not able to swallow? Is it the tonsils or is there any other pathology there? The child had apthe on the hard palate. We combine both these things and the remedy we get is borax. Never in my life I had imagined that, in acutes for fever, I will be using borax. Borax we have used. And after learning predictive methodology, borax we have used in various cases. But before that, I never thought of borax. After meeting sir, after learning from sir, now, a dose of borax, see the magic that it makes. Okay. So please give importance to examination. Many times, pulse can give us a lot of things. The pulse of pyrogenum. There is a rubric in your repertory, generals, pulse discordant with temperature. You know that, pulse and temperature, they don't match. So the first remedy that should come to your mind is pyrogenum. Similarly, when the pulse is less, okay, you can think of, typhoid, enteric fever, the remedies will be different. So examination, a characteristic tongue, it's in Restox, Apis tongue, and distribution of temperature. This is again very important. Never hesitate to examine the patient. Very important. If it is sulfur, they will have warm palms. If it is belladonna, head is hot, extremities are cold. If it is camphora, head is hot, the abdomen is cold. If it is arnica, head is hot, the entire body is cold. These are a few objective symptoms which you should not miss. And sometimes abdominal examination. Okay. For example, there is colic. You touch, the pain is more, but when you press, the pain is less. It can be an indication for cinchona. Okay. So these are few clues. You can add more from your practical experience, but never miss the examination point. Now, the follow-up criteria. For me, from the predictive school, the follow-up is good when the well-being of the patient is nice. When the patient feels good, there is general well-being, then the follow-up is correct. And Herring's law should be followed. The cure should happen according to Herring's law. This is very, very important. Now, what do I mean by Herring's law? If somebody comes to you with cough, after you give medicine, they will come with cold. Or somebody comes to you with cold, you give a medicine, the patient comes back to you happily and it tells, sir, cold has gone, but I have got cough. This is not the right treatment. We had a post-viral arthritis, lady with multiple joint pains. Now, what I mean by Herring's law is, it should go from above down. The symptoms should improve first in the shoulders and then it should go above down. So make sure Herring's law is followed, otherwise they will bounce back. Okay. Now, a last component I want to discuss here is, this is again a common problem many of we homeopaths face when there is a constitutional medicine that is given, and if some acutes come up, what to do? Okay, this is a very important thing. See, again, Hahnemann in his aphorisms, he says what to do. See, now, if a constitutional remedy is given, and if some acute comes up, in predictive school, what we do is we follow Vijaykrishna's theory of suppression layers. There are some 7 layers Sir has given. We see in which layer we are treating and what is that the patient has come up with. If he is going lower down the order, we will not touch. But if there is some acute presentation which has come, see, what is that acute presentation? Is it because of a small change in sleep, or is it because of some stress? Is it because of some food that this acute has come up? Or is it something very real, very serious that the patient is coming out with? If it is the first thing that I told you, very simple things, then please maintain with diet and regimen. If it is something very serious, which requires a homeopathic medicine, then we in predictive school, we follow a theory of acutes. Sir has given us a chart, we follow that chart, and we make sure the acute that we are prescribing is in relationship with the constitutional remedy that we have given. Majority of the times, if your constitutional remedy is right, patient will not come with acute emergencies. He will definitely go down the layer. You can wait. But an acute emergency, if he comes, you can look into the acute chart, take the causation, take the PQRS, and you can prescribe. Okay? Now, a few more things I would like to share here with you is, as a homeopath, never be a routinistic guy. Please be open to changes. Please be ready to experiment. If Dr. Hahnemann was a routinist, he wouldn't have invented this beautiful science. Okay? And please be unprejudiced. Every case for us is a new case. And this is what I'm trying to tell you in the next slide of mine. Don't have favorites. Pyrogenum, Ferrumphos, belladonna for fever, colocin for pain. This is what again Hahnemann says in aphorism 257. Please do not have favorite remedies. And one more slide that I'm showing to my right is, keep probing. Like for example, I've shown you they're drilling a borewell. They drill, they go deep till they get water. So till you get the PQRS, till you get what you want, you keep questioning. If there will be something PQRS, you should keep questioning and you should arrive at it. Very, very important. Okay. Now to recap, we understood how to take the acute case. We also felt the need for taking PQRS. Observations are very, very important. We also looked at when to repeat a remedy, and we also looked at the other challenges. What are the other challenges? For example, a new symptom coming up, acute coming up in chronic, okay? Or the importance of lab investigation. The potency here we use is, generally we use 1M and higher. The dynamicity will be more in acutes. So please don't give 30. Please give higher potencies, fine? And I would also like to tell you, this is a QR code. I keep talking about this in my college. Homeopathic remedies work only when they match. See, QR code of each of you will be different. Only if this matches, your money transactions will happen. Otherwise, they say, sorry, QR code not matched. Similarly, if your homeopathic remedy should work, the matching similia similibus curanter should happen. If it does not happen, then the remedy will not work. There's a beautiful quote. I have taken this from Stuart Close. It's the homeopath who fails and not homeopathy. Okay. Now I would like to take up the questions. Before I take up the questions from you, I have just had a last and final slide here. What I want to try to tell you here is, what I want you to understand here is, see, he's a cook who is very passionate about his job. He knows when to add or how much of salt should be added or how much of spices should be blent in. So what I'm trying to tell you is, this is a very divine science. There are a lot of students here, there are a lot of beginners here, there are a lot of experienced doctors here. What I'm trying to tell you here is, you as a homeopath should have the passion for our science, and you should know the art of blending the knowledge of organon, the art of blending the knowledge of Materia, Medica, Repertory, allied sciences, so that, you know, for a cook it is a dish, for us it is our patient who are our priority. So we should cook so that, or we should use the tools properly so that we give relief to our patient. Okay, and this is an app which is freely available. Many of you might be having this. We use this app, theory of acutes, in our day in and day out practice. Minimum 50 to 60% of cure is guaranteed, and 50 to 60% of cure is something very big. This is specially designed by Vijaykrishna sir. It's free. So as I told you, break the chain, don't be a routinist. You should be hoping and willing to look at changes. So please download this and use this. Before I take up your questions, I'm not ending here. I'm here to take up the questions. I would like to share, thank few people. My teacher, my principal, Dr. Guru Prasad sir, who is from Govt Homoeopathic Medical College, always encourages talent or the youngsters growing or presenting seminars. A big thank you for you, sir. And I would also like to thank Dr. Rajesh, who introduced me to BHOPAL College, the principal and staff of BHOPAL Govt Homoeopathic Medical College for the opportunity. I would also like to thank this gentleman. Many of the BHOPAL students might be very well, is a known personality, Dr. Nishant. Thank you, sir, for inviting me on this beautiful platform. I would like to thank Dr. Abhishek for all the technical help. And I really don't know how many other participants are there, who are there. I would like to thank all of you for being part of this learning. A lot of students who have come, lot of practitioners, lot of predictive senior practitioners are here. I would like to thank all of them. My colleagues who have joined in big number, thank you all. And questions? Yes, I will take up the questions now. I don't know how much time we have. Dr. Abhishek?
Yes, sir, we have time.
Yes, we have time. That's a good thing for us. And I would also like to thank, see, the concept I discussed with Dr. Manohar, a very good friend of mine. I also discussed with Dr. Devraj, my wife, Dr. Sujini. They have their own inputs. My entire team of Nishika Homeo Clinic assistant doctors. Any new concept I would discuss with them, and they give their inputs. Of course, the predictive school. Special thanks to Vijaykrishna sir, who is helping us evolve as a better doctor. Thank you, sir, for sharing all your valuable knowledge with us and helping us grow in our field. Special thanks to Dr. Dikshit, my young assistant, who took a lot of pain in arranging all those videos, masking the faces. Okay, thanks, Dr. Dikshit. Now, you can always keep in touch with me. The learning will not end here. You can give your feedback, good or bad, any areas I feel you should improve. This is what I have learned in a simple way. I've put it across. See, ultimately the success of seminar is not the number of participants who come to us. It's not the number. See, the success we feel happy as a speaker is when you apply this knowledge into your practice, and when this knowledge is reflected into your practice, and you see the same cure, you see the same results, that will be a big happiness for us. Thank you all for joining in big number. I have a lot of people, a lot of students who have joined from Bhagwan Buddha, Government Homoeopathic Medical College, and a lot of other places from all other places. Now quickly we will take up the questions. So Dr. Abhishek, will you read the questions, or should I look into the chat box and start answering?
Yes, sir, you can also. There is.
Okay, so I'll go ahead with the questions. Okay, so
Yes,
now
sir.
to start with, I mean, which repertory use? I see there are beautiful repertories. To be very honest, I use complete repertory. Okay, so we'll take few more questions. Which repertory we have done? What made you think of SCPH? Yeah, see, what made you think of SCPH in that case? See, one of the doctor wants to know. See, SCPH, I mean, there are a lot of things you need to know about SCPH. But one very important thing that we have learned from Vijaykrishna sir must be, if you download the TOA app, you see under the explanation sir has given in SCPH is bad effects of homeopathic remedies. So when a child becomes dull, when the child becomes weak, okay, the child after wrong homeopathic prescriptions, but the child should have the picture of sepia, meaning there was dullness, there was thirstlessness, and the child was chilly. So that basic thing of sepia was there, and then series of wrong homeopathic remedies which pushed the child into that state. That's why sepia was prescribed. Okay, so 1 second, we'll go step by step. Sir, what can we do when life-threatening acute cases come to our clinic? Yes, see, this is a beautiful question asked by one of the doctors here. See, when there are situations which are life-threatening, okay. See, I mean, if Vijaykrishna sir had to answer this question, or sir, he's training us in such a way that the sky is the limit, okay. But we catching up with Vijaykrishna sir's knowledge is very difficult. We are very slow, and sir is, super fast in his concepts. New things sir gives us. But to make things very simple here, Hahnemann in his aphorism, if I'm right, some 67, I'm very poor with the numbers. He says, when there are some life-threatening acutes, somebody comes with poisonings, poisoning, or somebody comes with accident, Hahnemann himself in his organon says, don't hesitate to refer the patient to an allopath. Okay. Ultimately for us, it is the life of the patient that is very important. When you feel you are not trained in treating such cases, please don't risk the patient's life or your practice and take up the cases that you are not trained with. Okay. So in the interest of the patient, if you feel you cannot, please do refer to a better homeopath or an allopath. I'll leave it to you. Okay, 1 second, we'll go ahead. Yeah, what made you think of hysteria is what one of my colleague wants to know. See, I also told you in that case, there was no obvious cause. And when things suddenly out of blue, like, you see that somebody is suffering so much, and then you don't see a specific cause, fine, that made me think of the rubric hysteria. That was taken in the end. Though Kafia covered other things, looking at her, with due respect to the patient, looking at her presentation, what struck my mind there was hysteria. Okay. Yes, any more questions? Yeah, there are many things you have answered. Continuous motion. Yeah, any more questions? Please type if you have anything to ask. Many of you have given beautiful interaction here. So questions wise, I don't see much here. You have interacted with the cases. Why anguish was taken was a nice question somebody wanted to know. See, now I told you from the presentation that the patient gave you, she was in so much of pain. She was in so much of mental agony. Now that is anguish. If you have that kind of a presentation tomorrow in your clinic, please think of anguish. That's why we shared the video so that you appreciate what anguish is, what mourning is, so that you don't miss those things in your cases or in your clinics tomorrow. Any more questions? Sir, after GCS, 1 second.
Sir, when you said
1 second. Why can't we read chat and comment on other? Why can't we read chat and comment of others? Okay, I don't know. Fine. What
yes, there is some question in chat.
Yeah, there's some technical issues. Don't worry. I am reading the questions. You please feel free to type it in the chat box. We will read and we will answer it. No problem. Or you can mail me. You can WhatsApp me. Not a hurry. In case of sleepless nights, what gets more weightage? Mortification or no support from wife? See, nice question. See, the support from wife was a symptom which helped me prescribe calcarea. Otherwise, I would have prescribed Staphysagra. Like many of you have given, no? I would have prescribed Staphysagra. That support part helped me differentiate calcarea, ignitia, colocin, and Staphysagra. Probably this could be a constitutional prescription also. I'm not very sure. We'll wait and we'll watch. You can keep in touch. I can give you more updates. Sir, after GCS, next day patient comes with high-grade fever, what to do? See, this is a beautiful question asked by one of the doctors. An acute coming immediately after a constitutional remedy is wrong. It means to say the GCS that you are given is wrong. Hahnemann, in some aphorism, I'll give you the number. In some aphorism, Hahnemann says, Sora will come in the end. Okay, let me just check. I've written. So what I was trying to tell you is, immediately a GCS, after a GCS, high-grade fever that you are talking of is not a good sign. Small disturbances, as I was trying to talk, can be taken care, but not a high-grade fever. Okay. In case of sleeplessness, yes. If we give a constitutional remedy for ovarian cyst and patient comes with headache and diagnosis is migraine, then what to do? Okay. See, for this, you need to understand the theory of suppression chart, what Vijaykrishna sir has mentioned. So ovarian cyst comes up in which layer? Fine. And in which layer the migraine comes, and accordingly we'll have to start looking into it. Okay, see, for example, ovarian cyst, as I understand, it comes in layer 5. And again, I'll try to tell you, for example, if two diseases are coming up in the same layer, okay, same layer, then go back to the pathology and see the weightage. If the new disease that has come up has more destructive pathology, or if it is of higher pathology, though they are in the same layer, then your remedy is wrong. Okay, the pathology, if it is if you are treating a psychotic problem, and if the pathology comes up is syphilitic, like for example here, ovarian cyst is psychotic, and migraine, which can be more psychosyphilitic. So as I understand, it will be a wrong prognosis. You may have to retake the case, and you may have to change the remedy. Okay. See, again, a very nice question. Role of LM potencies in acute cases. Personally, I have not explored LM potencies. I may have to take this as an experiment, and I'll have to see. But we have got good results with centesimal scale. So I have never seen the need for LM potencies, but I'll keep this in mind. At least the cases that we are not getting improvement with the centesimal, we'll explore with LM potencies. Okay. Any more questions? If you are done, or if you want to ask any more questions, you please feel free to keep in touch. Okay. So thank you again. Thanks to BHOPAL College for inviting, and thank you all for a very patient hearing. Thank you so much.